Thank you. Welcome to Senate Labor Health Committee. We will go ahead and call the roll, please.
Senator Crum,
Excused?
Senator Hutchings,
Here.
Senator Scott,
Here.
Senator Steinmetz,
Here.
Chairman Brennan.
Here.
Madam Chairman, we have a quorum.
All right, thank you. So today we are going to consider House Bill 4, Birthing Centers Medicaid Coverage, which was one that was sponsored out of the Joint Labor Health and Social Service Interim Committee. And Chairman Rodriguez-Williams is here. Would you like to present the bill?
Thank you, Madam Chairman. House Bill 4, Birthing Centers and Medicaid Coverage came out of the interim from Joint Labor and Health. Essentially what this bill does is it proposes a narrow and a new change to Wyoming's Medicaid program. The bill authorizes Medicaid reimbursement for services provided by licensed birthing centers, bringing those facilities within the list of services covered under the Wyoming Medical Assistance and Services Act. Under current law, Medicaid covers a wide range of medical services, but birthing centers are not explicitly included. This bill amends statute to add birthing center services as already defined in Wyoming law to the list of authorized Medicaid services. It does not create new birthing centers, change licensing standards, or alter the scope of practice. It strictly authorizes payment eligibility. And birthing centers are defined in statute, as I mentioned, under 35-2901A. And a birthing center means a facility which operates for the primary purpose of performing deliveries, and it is not part of a hospital. So, Madam Chair, that is the bill.
Thank you. Appreciate it. Committee, any questions? Who worked it? Senator Scott?
Madam Chairman, there's on page 2, line 2, birthing centers, services provided by birthing centers defined by WS 35-2901A3. And that statute has a reenactment that is effective this next July 1st, but the language, I believe, is exactly the same as defining the birthing center. Am I right in reading with that definition and this purpose that what we're doing is recognizing our problems in maintaining hospital OB and authorizing these things to be part of Medicaid so that they can do live births? Is that what's really going on here?
Madam Chair, Senator Scott, yeah, essentially, it's already defined in law, and this would just add to the list of authorized Medicaid services. So.
Yep. Any further questions, committee? Thank you. Does the department wish to speak to this bill? Welcome.
Good afternoon, Chairman Brennan, members of the Senate Labor. My name is Franz Fuchs, Deputy Director of the Department of Health, joined here by Jesse Springer, our state Medicaid agent. Certainly here to answer any questions you might have on this bill.
Committee, does anybody have any questions for the department? Senator Scott.
Madam Chairman, how much does live, uncomplicated, normal delivery live birth cost at a hospital, and how much will it cost a birthing center under this?
Madam Chairman, Senator Scott, so a couple things. We currently pay, if a birth happens in a birthing center, we pay the professional fees of a midwife. So we don't pay the facility fee to the center itself. We do pay the professional midwife fees. And that, if I recall correctly, and Jesse can certainly correct me, I think is around 70% of the physician rate for that birth on the professional side. The average cost for a live birth in Wyoming for Medicaid, inclusive of the physician and the facility fees, is around $7,000 to $8,000. And that's the number we report to DFS for that birth cost recovery. So that's the 60-day, within the 60-day time period. That's kind of the average cost that we've developed from that. And that includes both the physician and the facility fees. The facility fees for the birthing centers, we would contemplate at approximately the ambulatory surgical center level. So it would be less than a hospital, around 80% of the hospital. So I think on average, a birth in a birthing center with the facility fee included would be approximately 80%, 70-80% of a hospital birth cost. That does not, of course, include any one-off. If there's a high-risk birth that happens that has to be transferred, and there's maybe emergency costs or ambulance costs that have to transfer the baby, but that's just sort of an uncomplicated delivery type situation.
Thank you. Further questions?
Madam Chairman, so
Senator
there's
Scott.
no need for an appropriation for this.
Madam Chairman, Senator Scott, that's correct. This would be a net savings to the state.
Mhm. Any further questions for the department? Okay,
Madam
thank
Chairman,
you. Yes, Senator Scott.
one final question. What percent of the live births in recent years have been under Medicaid? Because I know it's been coming down, but I don't know where it is.
Chairman Brennan, Senator Scott, we've most recent Medicaid birth report, we produced this, put it on our website. 2024, there was 2,131 Medicaid births. There was 6,088 total births for a percentage of 35% of births on Medicaid. We're one of the lowest states for births on Medicaid.
Okay. Madam Chairman,
Senator Scott.
he's reading them off faster than I can write them down.
Chairman Brennan, I'll read slowly. 2,131 Medicaid births. And there were 6,088 total births in Wyoming. For a percentage of 35%.
Madam
Senator,
Chairman,
yes.
it used to be up to the high 40s, almost 50%. What's been responsible for the decline? Has that been our efforts to get the absent fathers to pay, or is this something else going on in the society generally?
Chairman Brennan, Senator Scott, we haven't done a deep research onto this topic, but there has been a significant decline in teen births. So the younger births has dropped dramatically. So you're seeing later births, early 20s, where and the teenager births is a very small number now that Medicaid is paying for. So that number continues to drop in each county. Really, it's quite interesting all across the state, not concentrated in one area or one region, but really across the state in that younger group, but also in all age groups, you're seeing general drops in Medicaid. It could be higher incomes when deliveries are occurring, later pregnancies, but there's just that continual drop over time.
Thank you. Any further questions? Okay. With that, we will open this up to public comment. So if anybody would like to come comment. Welcome. If you'd state your name for the record and give us your testimony.
Thank you, Madam Chair and members of the committee. My name is Sarah Maury, and along with my business partner, Allison Hayek, we own the first freestanding birth center opened in the state of Wyoming. Our birth center is located right here in Cheyenne, and we're on track to serve 60 to 80 families this year alone. We're actually CABC nationally accredited birth center. We have state licensed midwives and are hoping to be a model for other birth centers in the state to contribute to solving the maternal health crisis here in our state. And we are currently working diligently right now with the State Department on Health to get our state license for the facility. We recognize that the goal of this session is to save money for the state while supporting our citizens of Wyoming, and this bill does that. We want to just make sure that, as your questions have already been answered, that this is a Medicaid saving bill. We helped write this bill because this is the next legal step for the state of Wyoming to cover birth centers as recognized licensed facilities. The state regs and legislation on birth centers has long been in effect for many years, but up until now, no one's tried to open a birth center. Being in it now, trying for 3 years, I can understand why. It's quite the challenge. And basically, because the facility taxonomy code for a birth center is not an enrollment choice for Wyoming Medicaid, there's no way for Wyoming Medicaid to cover facility fees for a birth center. This means our hands are tied at collecting any facility fees. We have about 30% of our clients are Medicaid clients. So we are only getting, like Medicaid mentioned, 70% of the provider fee, but we're still covering 30% of our clients are Medicaid. This is just a straightforward bill that has no reason not to pass, as we've already licensed and regulated midwives and birth centers. This is just simply to ensure that taxonomy code for a birth center is enrollable in Wyoming, which would actually put Wyoming Medicaid into compliance with the national law. Federally, all insurance companies are required to reimburse for licensed facilities, including birth centers. Not only, as was noted earlier, that the payout for a facility fee for a birth center is typically lower, birth centers just overall reduce the risks of higher care births. So the C-section rate across the nation for birth centers is around 6% versus a hospital C-section rate of around 30%. And as places in Wyoming are getting fewer and fewer OBs and coverage there, birth is now becoming more expensive for the state because they're doing emergency services, they're not getting prenatal care, they're more likely to be transferred out of state. Part of our goal in starting the first birth center is to just pave that way for it to be easier for midwives to kind of step in and fulfill that role, not only with fewer interventions, but fewer costs as well. Again, this is just kind of transferring the payout, so it's not necessarily creating more births. You're paying a birth center versus a hospital birth. So even if Medicaid pays a facility fee to a birth center and that client transfers out of care for labor, there's really good statistics. The Strong Start studied Medicaid clients that even if they do get transferred, Medicaid still comes out ahead financially. Clients that end up transferring still have uncomplicated vaginal births, shorter hospital stays, and higher breastfeeding rates. And again, this kind of just puts the state of Wyoming back into compliance once we get licensed. Thank you.
Thank you. Committee, any questions? Okay. Anybody else in the room who'd like to testify? Okay, we have one person online. So.
Hello, can you hear me?
We can. So if you give us your name and let us know your thoughts on this bill, we'd appreciate it.
Thank you. I am Allison Hayek. I am co-owner of Earthside Birth and Wellness Center in Cheyenne. The passage of this bill will save Medicaid money, as we've talked about, and will increase access to midwives for Wyoming residents. We We're very, cognizant of keeping this bill to be a very narrow scope, very specific. It simply adds the taxonomy to Medicaid. It makes no other changes. We want this to be clean and quick. So we urge the committee to pass it today. Thank you.
Thank you. Committee, any questions? Thank you. Appreciate it.
Chairman.
Oh, Senator Scott.
Madam Chairman, is yours the only birthing center currently in the state?
Madam Chairman, Senator Scott, we are aware of one additional practicing center in the town of Evanston.
Any further questions? Great. Thank you very much. Okay. With that, committee, we will close public comment. What is your pleasure?
Move the bill.
Moved by Senator Steinmetz, seconded by Senator Hutchings. Any discussion on the bill? No discussion? Okay. Well, I'll just say I think this was good work by our interim committee on this bill in really looking at ways to move forward with OB care. And I think this is one step forward in just trying to help with some of our OB deserts and stuff. It's not going to fix everything right away, but this is definitely a step in the right direction. So I appreciate what the committee did in the interim. And with that, we'll take the roll call.
This is a roll call vote for House Bill 4. Senator Crum,
Excused?
Senator Hutchings,
Aye.
Senator Scott,
Aye.
Senator Steinmetz,
Aye.
Chairman Brennan.
Aye.
Madam Chairman, that is 4 aye and 1 excused.
Thank you very much. Committee, is there anybody who wants to take this on the floor? Do either of you? Or I can do it. Okay. Senator Hutchings? It's yours. All right. Thank you.
Thank you.